This drug, Arranon Vial, is used to treat specific types of cancer, such as leukemia and lymphoma. It is a chemotherapy drug that works by slowing down or stopping the growth of cancer cells. Before using Arranon Vial, make sure to read the patient information leaflet from your pharmacist. This medication is given by slow injection into a vein, usually by a healthcare professional. The dosage and treatment schedule will be determined by your doctor based on your medical condition, age, and response to treatment. Remember to keep all medical and lab appointments. Common side effects of Arranon Vial include headache, nausea, vomiting, loss of appetite, constipation, diarrhea, cough, shortness of breath, dizziness, drowsiness, and tiredness. Your doctor may prescribe medication to help with nausea and vomiting. Eating small meals and limiting activity may also help with these side effects. Be sure to tell your doctor if any of these side effects persist or worsen. Serious side effects may occur, such as easy bruising or bleeding, swelling of the ankles or feet, or signs of infection like a persistent sore throat, fever, or chills. Your doctor will monitor you closely to decrease your risk of these side effects. Nelarabine can cause a rapid destruction of cancer cells, leading to side effects known as tumor lysis syndrome. Your doctor may prescribe medication and recommend drinking plenty of fluids to lower your risk. Contact your doctor if you experience symptoms such as lower back or side pain, signs of kidney problems, or muscle spasms or weakness. While rare, a serious allergic reaction to this medication may occur. Seek medical help if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of side effects. Be sure to contact your doctor or pharmacist if you notice any other effects not listed here. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088, and in Canada, you can report them to Health Canada at 1-866-234-2345. Serious nervous system problems have been reported with the use of Arranon Vial. The risk of these problems may be higher if you have previously received chemotherapy injection into a certain part of the spine or radiation treatment to the head/spine area. If you notice symptoms such as extreme sleepiness, confusion, numbness or tingling in hands or feet, loss of coordination, muscle weakness, or unsteadiness while walking, it is important to tell your doctor right away. Inability to move or seizures may also occur and require immediate medical help. These symptoms may not completely go away even after stopping treatment with nelarabine. Be sure to consult your doctor for more information. Before using nelarabine, make sure to tell your doctor or pharmacist if you have any allergies or if you have a history of certain medical conditions. This medication can increase your risk of infections, so it's important to avoid contact with anyone who may have a contagious illness. Also, be cautious with sharp objects and avoid activities that may result in injury. If you are planning to have surgery or dental work, be sure to inform your doctor about all the medications you are taking. Additionally, this medication can cause dizziness or drowsiness, especially in older adults. It's important to avoid alcohol and marijuana while using nelarabine. If you are pregnant or planning to become pregnant, consult your doctor about the potential risks and use of reliable birth control. Breastfeeding is not recommended while using this medication, so it's best to talk to your doctor before breastfeeding. It's important to be aware that Arranon Vial can interact with other medications, potentially changing how they work or increasing your risk for serious side effects. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. This includes prescription and non-prescription drugs, as well as herbal products. Don't start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this drug include other anti-cancer drugs, especially pentostatin. Also, let your doctor or pharmacist know if you are taking other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or antihistamines. It's also important to check the labels on all your medicines, including allergy or cough and cold products, as they may contain ingredients that cause drowsiness. Always ask your pharmacist about using those products safely. If someone has taken too much Arranon Vial and is experiencing severe symptoms like fainting or difficulty breathing, it's important to call for emergency help right away. In the US, you can contact your local poison control center at 1-800-222-1222, and in Canada, you can reach out to a provincial poison control center. Make sure to have regular lab and medical tests while using Arranon Vial. It's important to keep all your appointments with your doctor and the lab. If you have any questions, consult your doctor for more information. Make sure to take each dose of Arranon Vial as prescribed by your doctor. If you happen to miss a dose, speak to your doctor or pharmacist immediately to get a new schedule. Do not take a double dose to make up for the missed one. This medication is not for home use and will be administered in a clinic. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.